Welcome to this concise instructional video on WHO standard scalp acupuncture. In this presentation, we will provide an overview of the system, delving into its historical roots, mechanisms, representative linear acupuncture points, clinical applications, and some research. By the end of this video, you will have gained a comprehensive understanding of this remarkable point system. WHO standard scalp acupuncture is a modern acupuncture system that focuses on a specific set of points located on the scalp. This system is based on two fundamental aspects. Firstly, it draws from the extensive acupuncture meridian system, which includes various channels that extend to the head, such as the bladder, stomach, and gallbladder meridians, among others. These meridians are frequently utilized to address various head-related disorders, e.g. headache and dizziness. Secondly, WHO standard scalp acupuncture incorporates an understanding of the anatomy and physiology of the brain, particularly the functions of the cortex. Different regions of the brain are associated with different bodily functions, such as digestion, heart rate regulation, and excretion. The brain serves as a central control hub for the entire body. This system's point configuration was initially documented in 1991, coinciding with the WHO standard scalp acupuncture system is closely related to the earliest scalp acupuncture system, initially established in 1971 by Professor Jiao Xuanfa. Since then, numerous scalp acupuncture systems have been developed by various masters and in different styles. Examples include Fan Yunping scalp acupuncture, Tian's acupuncture, Yamamoto Nu scalp acupuncture, YNSA, and others. The WHO standard scalp acupuncture is notably one of the simplest yet highly effective systems. Its simplicity lies in the fact that it comprises only 14 specific points, categorized from MS1 to MS14. The MS in this context stands for microsystem, signifying the microsystem of the scalp. These 14 points are strategically distributed, 4 points i.e. MS1, 2, 3, 4 on the forehead, 2 on the temporal region i.e. MS5, 8, 9, 3 on the vertex temporal region i.e. MS6, 7, and 3 on the occiput i.e. MS12, 13, 14. This well-structured arrangement, the WHO standard scalp acupuncture system is best utilized based on the collective experience of acupuncturists and doctors in clinical practice. It is highly recommended for treating a wide range of conditions, particularly those pertaining to neurological and mental health, as well as various peripheral and internal ailments. Firstly, it demonstrates remarkable efficacy in addressing neurological conditions such as headaches, dizziness, strokes, facial paralysis, tinnitus, and dementia, among others. Essentially, it proves valuable in treating both the central nervous system and the peripheral nervous system. In China, scalp acupuncture is considered an indispensable method for managing conditions like stroke. I vividly recall my initial visit to the acupuncture department, where I witnessed numerous stroke patients undergoing treatment with scalp acupuncture. Secondly, the system has shown effectiveness in treating various psychological and psychiatric conditions, including depression, anxiety, PTSD, autism, and insomnia. The rationale behind its success lies in the direct stimulation and regulation of specific vertex regions, which can have a significant impact on these disorders. Furthermore, scalp acupuncture can be applied to address a spectrum of other health issues, such as gastrointestinal problems, cardiac conditions, and musculoskeletal disorders. These applications are often rooted in the meridian connections extending from the head to the internal organs, as well as the intricate physiological correspondence between the brain and internal organs. In summary, when considering the use of scalp acupuncture, it is primarily recommended to address the first two categories of conditions, neurological and mental health disorders. The effectiveness of this system can be attributed to its unique ability to directly influence the Shen, or the spiritual aspect, in traditional Chinese medicine, TCM. Within TCM, there are two forms of Shen, known as Yuan primary Shen and Sure intelligent Shen. Yuan Shen, which is associated with ordinary consciousness, is traditionally believed to be governed by the heart. On the other hand, the brain plays a central role in managing Yuan Shen, which is often seen as our subconscious. This subconscious aspect is closely linked to the kidney in TCM, while the conscious is related to the heart. The kidney is closely associated with the latent, deep aspects of the mind. In Taoist medicine, the brain is metaphorically referred to an Iwan/mud pill as soft tissue, resembling the concept of the upper dantian. Dantian refers to internal alchemy. The scalp acupuncture system leverages this understanding by employing various points on the head to treat a wide range of neurological, psychiatric, and physiological disorders. Examples of these points include gallbladder 20, gallbladder 13, and Du 0. Du 20, also known as Bai Hui, is aptly named the meeting place of 100 because it signifies the convergence of all channels, particularly the yang channels, at the vertex of the head. This crucial point serves multiple functions. 1. Calming wind and rebellious qi. Du 20 is effective in addressing conditions related to the rising of wind and rebellious qi, which can manifest as headaches, dizziness, tinnitus, and various discomforts. 2. Enhancing brain and spinal cord function. It plays a role in strengthening the function of both the brain and the spinal cord. This can be particularly beneficial for conditions involving degeneration, such as dementia and memory problems. 3. Refreshing Shen. Du 20 can soothe and refresh the Shen spirit. It is often employed when individuals feel excessively fatigued, restless, sleep-deprived, or burdened by worries. 4. Lifting yang. This point not only sinks qi but also elevates it, especially when combined with moxibustion therapy. It is highly effective in lifting collapsed qi or yin, addressing various symptoms of collapse, such as incontinence or organ prolapse. 5. Balancing the 5 orifices. Du 20 has the unique capacity to harmonize the functions of sensory organs, the eyes, ears, nose, mouth, and tongue. For instance, in cases of post-COVID-19 loss of smell or taste, Du 20 can be employed to help alleviate these symptoms. In summary, Du 20, or Bai Hui, is a versatile acupuncture point with a wide range of application, making it a valuable tool in addressing diverse medical conditions related to the head and beyond. The Meridian network plays a crucial role in connecting the brain to the entire body. It's well established that all young meridians have pathways leading to the head. However, there are also yin channels that either directly or indirectly link to the head or brain. For instance, the liver channel has a branch that directly connects to the vertex or Du 20. The kidney channel likewise has a branch that ascends to the brain, anterior to the spine. The heart channel extends a branch to the eyes, the lung channel connects to the throat, and the spleen channel has a branch reaching the tongue. In addition to these major meridians, there are 365 minor collaterals known as lual collaterals. These intricate connections also converge on the head, forming a complex network that links the brain to the entire body. Consequently, this multi-layered network bears a striking resemblance to the nervous system. Microsystems, such as auricular acupuncture, are also integral to this intricate network. The ear, with its shape resembling that of a fetus, is just one of many microsystems found in the body. These include eye acupuncture, hand acupuncture, abdomen acupuncture, and others. Remarkably, on the forehead, we find 4 points, MS1, 2, MS3, and MS4, each of which corresponds neatly to different parts of the body. MS1 relates to the head, MS2 to the chest, MS3 to the stomach, and MS4 to the abdomen. Scalp acupuncture is highly effective due to its foundation in the anatomy and physiology of the brain cortex. This approach takes into account the intricate map of the brain's cortex, which is divided into 14 regions, each responsible for controlling various functions throughout the entire body. For instance, Region 3 governs bodily movement, while Region 9 is responsible for processing sensations. Scalp acupuncture utilizes this detailed knowledge to target specific regions of the brain. Notably, scalp acupoints such as MS6 and MS7 are strategically placed to directly stimulate these corresponding brain regions. By aligning acupuncture points with the brain's functional areas, scalp acupuncture harnesses the body's innate healing mechanisms, making it a highly effective therapeutic modality. Indeed, Region 9, often referred to as the sensory homunculus within the human brain, plays a pivotal role in controlling bodily sensations. This region can be further subdivided into three distinct parts, each responsible for processing sensory information from specific areas of the body. 1. Upper. This portion of the sensory homunculus is primarily associated with sensations originating from the legs, abdomen, and trunk of the body. 2. Middle part. The middle segment of the sensory homunculus is responsible for processing sensory input from the arms and fingers. 3. Lower part. The lower section sensory homunculus is dedicated to sensations from the face, eyes, tongue, lips, and other facial features. Understanding this division within Region 9 allows for precise targeting of acupuncture points, such as MS7 in scalp acupuncture, to directly influence and modulate sensory perceptions and experiences throughout the body. Certainly, let's delve into some examples of WHO scalp acupuncture points located on the forehead. These points are organized into 4 lines, named MS1 to MS4. Certainly, let's delve into some examples of WHO scalp acupuncture points located on the forehead. These points are organized into 4 lines, named MS1 to MS4. Each of these 4 linear acupuncture points is situated half cun above and below the hairline. When puncturing these linear acupoints, it is required to stimulate the entire 1 cun line. This typically involves inserting the needle to a depth of approximately 1 cun, ensuring effective and precise treatment. The functions of scalp acupuncture points, particularly those located on the forehead, are indeed closely associated with the anatomy and physiology of the frontal lobe of the brain. These points have indications that encompass various cognitive and emotional processes, including 1. Executive processes. These points can influence executive functions, such as decision-making, planning, and goal setting. 2. Voluntary behaviors. Scalp points in this area may impact voluntary behaviors, including motor control and the initiation of purposeful actions. 3. Problem solving. They can play a role in problem-solving abilities, helping individuals navigate challenges and find solutions. 4. Intelligence. These points may contribute to cognitive functions associated with intelligence, including reasoning, memory, and learning. 5. Language processing. Points in this region can influence language processing, encompassing both the production and comprehension of language. 6. Language comprehension. They may affect the brain's ability to understand spoken or written language, contributing to effective communication. 7. Self-control. Scalp acupuncture points can influence self-control, aiding individuals in managing their impulses and behaviors. And 8. Emotions control. These points might play a role in regulating emotions, helping individuals maintain emotional stability and respond effectively to various situations. Given their impact on these cognitive and emotional processes, it becomes evident why these scalp points are particularly effective in the treatment of various mental disorders. By targeting the frontal lobe's functions, scalp acupuncture can help address conditions related to cognition, emotion, and behavior, offering valuable therapeutic possibilities for individuals with mental health challenges. Indeed, the 4 linear acupoints on the forehead can be viewed as a microsystem, offering a condensed representation of the body's functions. When the image is rotated 90 degrees, it resembles a standing person, with each point corresponding to specific areas of the body. MS1, located at the top, utilized to address Shen, spirit, and head-related disorders, targeting mental, emotional, and neurological well-being. MS2, representing the upper jiao or chest, is employed to treat conditions associated with the chest area, potentially including respiratory and cardiac issues. MS3, situated in the middle, is linked to the digestive system, encompassing the liver and spleen. It is used to address gastrointestinal and digestive disorders. MS4, positioned at the bottom, is connected to the lower jiao and organs in the lower abdomen, such as the kidney, intestines, and genital area. It is applied treatment of conditions affecting these regions. This microsystem approach allows for targeted and efficient treatment of various bodily systems and functions, making it a valuable tool in precise acupuncture therapy. Indeed. Next, let's explore MS6 and MS7, two crucial scalp acupuncture points with specific anatomical connections. MS6 is located along the longitudinal line connecting Qian, Shen and gallbladder 6. Qian Shen is one of the Shen points, situated 1 cun anterior to Du20, also known as Bai Hui. MS7 is defined as the collection of points extending from Du20, Bai Hui, to gallbladder 7. These two lines correspond closely to the motor and sensory cortex regions of the brain. This precision makes MS6 and MS7 valuable in addressing a wide range of neurological and motor-related conditions in scalp acupuncture therapy. The division of MS6 and MS7 into three distinct parts highlights their specific functions and applications in scalp acupuncture therapy. Upper 1/5. The upper 1/5 of both MS6 and MS7 is utilized to treat conditions related to the lower part of the body, which includes the legs, abdomen, and torso. For example, the upper 1/5 of MS6 can be employed to address issues like immobile legs, while the corresponding portion of MS7 may be used to treat numbness and pain in the legs following a stroke. Middle 2/5. The middle 2/5 of these points are dedicated to treating conditions affecting the hands, arms, neck. This area is valuable for addressing neuropathy resulting from chemotherapy or conditions like immobile shoulders due to frozen shoulders. Lower 2/5. The lower 2/5 of MS6 and MS7 are associated with the head, including the ears and tongue. This portion of the points can be used to conditions such as aphasia or loss of smell and taste following a COVID-19 infection. This division of the points allows for precise and targeted treatment, making MS6 and MS7 valuable tools in scalp acupuncture therapy for addressing a wide range of neurological and sensory-related conditions throughout the body. The research conducted by Liu et al. Is indeed significant and highlights the potential effectiveness of scalp acupuncture in the treatment of middle cerebral artery acute ischemic stroke. By utilizing scalp acupuncture points including MS5, the connection between Du20 and Du21, MS6, and MS7, they were able to investigate the impact of this therapy on patients. The use of resting state functional magnetic resonance imaging, RSFMRI, and simplified Fugl-Meyer assessment, SFMA, scores allowed for a comprehensive evaluation of the treatment's effectiveness. The findings indicate that scalp acupuncture can have a specific and beneficial effect on enhancing the functional activities of brain regions associated with sensory integration, language processing, and motor coordination. This research underscores the potential of scalp acupuncture as a valuable therapeutic approach for patients recovering from ischemic stroke, providing insights into its positive impact on brain function and recovery. There is a case report on phantom pain and phantom limb sensation. The team treated a 71-year-old woman who suffered armed phantom limping with the phantom limb sensation after surgical computation. In this case, the treatment protocol involved the use of Shishinkong, 4 flowers, and MS7, with Du20 being a key for addressing head and brain-related disorders, including phantom limb symptoms. The stimulation of Shishinkong points can be seen as indirectly influencing Du20. Maybe you still remember that MS7 is used to treat all sensory disorders. The rapid and significant relief experienced by the patient after the first treatment is impressive. The subsequent sessions further reduced the severity of phantom limb pain and sensation, ultimately leading to complete freedom from these distressing symptoms. The absence of adverse effects and the sustained positive outcome over a 6-month follow-up period demonstrate the potential benefits of scalp acupuncture in challenging conditions like phantom limb pain and sensation. A study conducted by Li et al. Is valuable in shedding light on the potential benefits of combining scalp acupuncture with exercise therapy in the context of ischemic brain injury in rats. Their findings reveal that this combined treatment approach has a protective effect on neurons, specifically by 1. Downregulate inflammatory mediators. The treatment helps reduce pro-inflammatory mediators, which can contribute to inflammation and damage in ischemic brain injury. 2. Reducing reactive oxygen species, ROS, by decreasing ROS levels, which are associated with oxidative stress and tissue damage. The therapy mitigates oxidative damage to neurons. 3. Increasing superoxide dismutase, SOD, production. The elevation of SOD, an antioxidant enzyme, indicates improved defense against oxidative stress. 4. Enhancing brain-derived neurotrophic factor, BDNF. BDNF is a neurotrophictor that supports the growth and survival of neurons. Its increased production suggests neuronal protection and growth. 5. Boosting astrocyte activities. Enhanced astrocyte activities can contribute to neuronal support and repair. The results from Part A of the figure demonstrate a significant reduction in Peterson's, indicating improved neurological function in the experimental group. Additionally, Part B of the figure illustrates that the brains of the experimental group exhibited the best blood circulation, as evidenced by their red color. This suggests that rats in the experimental group had the smallest infarct volume, C parts, reflecting a positive outcome in terms of ischemic brain injury. Overall, these findings suggest that the combination of scalp acupuncture and exercise therapy can be a promising approach to mitigate the effects of ischemic brain injury by modulating inflammation, oxidative stress, neurotrophic factors, and brain circulation. Thank you for watching this video. If you are interested in learning more about WHO scalp acupuncture, you can find additional information, courses, research updates, and blogs on our website at www.zhang.ac and www.heititu.dk. You are also welcome to visit our Facebook page for updates and further insights.